Hi everyone, it's Dr. Charlotte Hodges, and today I wanted to talk a little bit about gallbladder disease before and after weight loss surgery. So it's not uncommon for me to get the question, Dr. Hodges, do I need to have my gallbladder out at the time of surgery? And the answer is a resounding no. Research has certainly shown that even though you might be at a higher risk for developing stones, particularly if you've lost a significant amount of weight after surgery, you don't need to have your gallbladder taken out at the time of surgery. Only 7% of patients that undergo weight loss surgery ever become symptomatic and need to have their gallbladder out. That means the other 93% never have an issue, even if gallbladder stones have formed. Patients that undergo prophylactic cholecystectomy or prophylactic gallbladder removal at the time of their weight loss surgery, they do have an increased risk for complications, increased hospital stay, and increased OR time. And for that reason, along really with the really low rates of just gallbladder stone formation, leads us to have the recommendation that prophylactic cholecystectomy is not indicated. So what do we do if somebody comes in and they already have symptoms of gallbladder disease? Pardon me. So if somebody comes in and they've been having pain in their abdomen in their right upper quadrant, they've had an ultrasound, they know that they have gallbladder disease, and they've been symptomatic with that, then at that time I will remove their gallbladder at the time of their bariatric surgery. Otherwise, if it ain't broke, then don't fix it. So what actually puts you at risk for developing gallstones? Studies show that if you have lost about greater than 25% of your excess body weight within the first 6 months, this does put you at a significantly higher risk for needing to have your gallbladder out. But please remember, of all the patients that undergo bariatric surgery, only 7% will really ever need to have the gallbladder removed. So then, so now what do you do if you're having symptoms after you've had weight loss surgery? So after weight loss surgery, you've lost some weight. Now you're coming in and you're having any issues with reflux, if you're having a lot of bloating after surgery, or if you find that you're having pain in your right upper quadrant, in your mid-abdomen, especially if it's after you eat a greasy meal, that really might mean that you do have some gallstones that are causing you some problems. Typically, if I have a patient that comes in and they're presenting with these symptoms, I'll start them on an acid blocker because it could be that you just have some reflux, some inflammation in your stomach. But then I'll also go ahead and get an ultrasound on you to see, do you have stones or some sludge or sand in your gallbladder that could be causing these issues. If that ultrasound comes back negative, then I'll also order a Hodges scan. That's a nuclear imaging test to see how well the gallbladder is actually contracting. For me in my practice, if I find that somebody's gallbladder is not squeezing like it should, if you have stones, sludge, and you're symptomatic, then I will go ahead and get you set up for a laparoscopic cholecystectomy. These are typically going to be surgeries that are performed on an outpatient basis. The good news is that it's not like weight loss surgery. There's no special diet that you have to do afterwards. Actually, for most people, they find that once they have their gallbladder removed, they feel fantastic. And they now can eat foods with a little bit higher fat content. So I hope that this really helps you guys with whether or not you need to have gallbladder removal at the time of your surgery. It is a resounding no. So just know that you're having the standard of care if your surgeon only offers you weight loss surgery and not weight loss surgery with gallbladder removal. Thanks so much. If you found this helpful, give me a thumbs up. Don't forget to subscribe and feel free to share this with your friends. Bye.